name is Lauren Apple. I'm going to be your nurse practitioner today. Today we're going to be doing an abdominal assessment. So first I'm just going to start off by lifting up your shirt just to kind of visually inspect your abdomen here. Your abdomen is symmetric, your contour is flat and regular. I'm not noticing any visible peristalsis or bulging, not noticing any umbilical bulging. Your skin is warm to touch. Doesn't appear to be red or pale. I'm not noticing any striae or lesions, any scarring. All looks very regular. Next up, I'm going to start off by taking a listen to your abdomen using the diaphragm of my stethoscope. Okay, your bowel sounds are normal and active in all 4 quadrants. I'm now going to listen to any friction rubs over your liver. Not feeling any friction rubs. Now your spleen. Not noting any friction rubs there. Next up, I'm going to take a listen for any bruits in any of your arteries. This is your aorta. No aortic bruits. No renal bruits that I'm hearing. It's your iliac. Okay, next up, I'm going to listen to your femoral arteries. I'm not hearing any bruits. Okay, next up, I'm going to take a listen for any venous hums. Not hearing anything abnormal on auscultation. There are no venous hums. All of your arteries do not have any bruits when I'm listening. Next up, I'm going to percuss over all 9 quadrants of your abdomen. You're just going to feel a little tapping like this. Okay, all areas are tympanic on percussion. Next up, I'm going to locate your liver by percussion. Okay, so less there. Okay, I'm gonna palpate up here until I note dullness. Okay. Okay, I'm gonna take my ruler. Your liver is 8.5 centimeters. That's normal. Next up, I'm going to percuss for your spleen. If you don't mind taking a deep breath and holding it. Okay. Your spleen is tympanic on percussion. Next up, I am going to do some palpation. So first, I'm going to just gently feel. Then I will kind of push a little bit harder. Let me know if you have any tenderness. Not feeling any masses. Not noting any tenderness. I'm going to next up use both of my hands. This is a little bit deeper. Not feeling any bulging, masses, or hernias during either palpation technique. Next up, I'm going to have you kind of take a deep breath. I'm going to try to feel the liver edge here. Okay. Okay, and then again, I'm going to have you take a deep breath. Okay, I'm not able to palpate your spleen. That's normal. That just notes that your spleen is normal size. Lastly, I'm going to palpate your kidneys. Okay, very good. No tenderness was noted during any of that exam. Next up, I'm going to have you sit up. Up here. Okay, and then I'm going to have you turn your legs around towards this way. Okay. And I'm going to lift up the back of your shirt. Okay. I'm just gonna do a little tapping on your back, and I want you to let me know if it's tender.
Nope.
Okay, so negative CVA tenderness. I'm gonna have you lay back down. If you can lay almost flat. Great. So next up, I'm going to be assessing for any like appendicitis signs, or any cholecystitis signs or ascites. Okay, so first I'm gonna gently push down here. Do you have any right-sided tenderness when I do that?
No.
Okay, that's a negative rousing sign. Next up, I'm gonna have you extend this leg all the way out and lift up. Okay, any pain in your right lower quadrant?
No.
Okay, that's a negative psoas sign. Next up, I'm going to do a little bit of flexion here, and then I'm gonna turn your leg in. Do you have any pain there? Okay, it's a negative obturator sign. Okay, I'm going to have you take a deep breath. Okay, no pain there. Okay, that's a negative Murphy sign. I'm gonna have you turn onto your left side, and I'm just checking for any migration of fluid, any ascites. Okay, no visible migration of fluid. I'm not, membranes continue to be tympanic throughout. So that would be a negative ascites sign. Then I go ahead and have you sit back up. That concludes our exam for the day. Thank you very much for coming in, and I hope you have a great day.
Thanks.